everyone, and welcome to our Monday Minute. Today we're going to discuss a hot topic in the next few months for sure for most home health and hospices, and that is submission of your annual Medicare Cost Report. The OIG has recently issued a report following an audit of cost reports conducted to ensure that the Medicare MACs have been doing their job as far as oversight is concerned with the Medicare cost report filings. They were not happy. The OIG was very disturbed at the 70% failure rate of the Medicare MACs in the effectiveness of cost report oversight. As a result of this, they have made recommendations to CMS. And we do believe that in the very near future, we will see an uptick of the audits, etc., that take place at the Medicare MACs regarding your Medicare cost reports. In years prior to the PPS system, when the home health agencies were under a cost reimbursement system, the Medicare cost report was the most important document that a home health agency could keep track of, because it was going to directly impact their reimbursement. As we moved into the PPS system and moved through the years, the cost report has become not quite so important to home health agencies individually, but their importance of the cost report has not lost its value as a whole. What do I mean? I mean that the CMS system is still utilizing data from the Medicare cost reports to determine our future payment rates. And if our cost reports are not accurate, then it's going to impact how we are paid in the future. The same applies to hospice. It is very disturbing to know that as CMS begins to gather the cost report data annually, there is a huge percentage of cost reports that are completely eliminated from the calculations because of the lack of accuracy found within those cost reports. I am not here today trying to get you to let me do your cost report, because that is one service that Healthcare Provider Solutions does not provide. However, I am begging you, honestly, to be very meticulous in the cost report data that you are gathering on your home health and hospice throughout the year, and that the cost reporting you do provide to CMS annually is as accurate as it can possibly be, and that you are hiring a professional to complete your cost reports, and that you are not just letting anyone and everyone that can fill out a form do that. It is very important that someone with experience is putting those cost reports together for you, and that you are providing them as accurate, detailed information as possible. They truly do still use the cost report data, again, to establish our future rates, and it's extremely important. Again, as a result of this OIG investigation, we do anticipate there will be an uptick in the oversight and possible rejection of cost reports as they are being filed. For those of you unfamiliar with the timeliness of the annual cost report, it is due by the last day of the 5th month following your fiscal year end. So it could be different depending on your fiscal year end. If Healthcare Provider Solutions can help you with any of the regulatory requirements surrounding your cost reporting, please don't hesitate to reach out. And of course, we're here to serve in all capacities, both home health and hospice. Have a fabulous week.